ADHD mixed and depression, stress and other disorders. Anxiety, depression, or ADHD. It could be all three. ADHD is often missed when it coexists with depression or anxiety, and vice versa. Here's what to look for, and how to ensure you get a thorough and accurate diagnosis. Studies find that 80% of people with attention deficit disorder, ADHD or ADD, will have at least one other psychiatric disorder in their lifetime. The two most common are depression and anxiety disorder, like obsessive compulsive disorder, OCD, or generalized anxiety disorder, GAD. ADHD without a comorbid disorder is the exception rather than the rule. Having ADHD is challenging enough, but the other disorders that accompany ADHD profoundly affect a person's daily life. The ADHD has been diagnosed, but the comorbid disorder has not been. Doctors sometimes mistakenly chalk up depressive and anxiety symptoms to the ADHD diagnosis. A secondary diagnosis does not make anxiety less challenging to live with. There is a parallel to substance abuse diagnosis. Proper diagnosis relies on a comprehensive clinical evaluation by a health professional who will take into account personal history, self-reported symptoms, and mental status testing, as well as early development problem and symptoms of inattention, distractibility, impulsivity, and emotional instability. Treatment. Medication is a cornerstone of treatment for adults with ADHD. Research has shown that stimulants and some non-stimulants can improve the symptoms of ADHD, helping people pay attention, concentrate, and control their impulses. Most people also benefit from behavioral, psychological, educational, and coaching interventions. A helpful resource for locating support groups or professionals with appropriate expertise is CHAD, Children and Adults with Attention Deficit Hyperactivity Disorder. Questions. What other mental disorders come with ADHD? Roughly 80% of those with ADHD are diagnosed with at least one other psychiatric disorder sometime during their life. Can you have ADHD and depression and anxiety? Adults with ADHD are likely to have an anxiety disorder, depression, bipolar disorder, or other comorbid psychiatric disorder. The term comorbid refers to a condition that exists with another.